is typically happening to children between 3 and 15 years of age. And this happens in 70 to 80% of the cases after about 1 to 2 months of COVID infection. Mind you, many children have had silent COVID infection. So they may never have tested COVID positive, but they may have had someone in the family having had COVID infection. And in fact, there are serology studies in India which suggest that 65 to 70% of the children have antibodies, which suggests that they have had infection, but we just don't know about it. So 70 to 80% of these children who have unexplained hepatitis, which means inflammation of the liver, which means the liver tests going wrong, them developing jaundice, and elevation of enzymes such as SGOT and SGPT. This happens typically 1 to 2 months after COVID infection. And this is thought to be related to the fact that COVID virus or coronavirus somehow changes the immune system of the body. And normally, viruses which do not cause hepatitis can actually become activated in the body and cause hepatitis. Now, there are several theories as to why post-COVID unexplained hepatitis happens in children. One is the theory that somehow the immune system changes, and 1 to 2 months later, these children get hepatitis because of immune activation in their systems. The second is related to adenovirus. Now, adenovirus is a type of virus that exists in children sometimes, and sometimes it causes nausea, vomiting, diarrhea, minor gastrointestinal illness, but never serious liver illness. But after COVID, many of these children have been found to have adenovirus, specifically the 41F type of variant, which is associated with these children having hepatitis. So again, that suggests that somehow COVID has changed the immune system or the immune response in these children, which is why they get hepatitis. Now, what will happen is that they will typically develop jaundice, elevation of liver tests, and this happens 6 to 8 weeks after COVID infection. In some cases, there is no history of COVID infection. And then they have to see a pediatrician or even better to see a pediatric liver specialist. And then they are treated with supportive measures, and 95% of them, they get okay. But 5 to 10% of them have severe liver failure. And we've actually lost a couple of children in the last 6 months from COVID-associated hepatitis. There are other countries in the world where some children with liver failure have had to have a liver transplant. But this is rare. Usually, the hepatitis that you're talking about does not kill or does not cause very severe liver failure. Now, this can be prevented by keeping a close watch on children who've had COVID infection. And typically, for the first 3 months after COVID infection, they should have repeated liver tests, like a liver function test that's a blood test. They can have it every 2 weeks for the 3 months after the COVID infection. Or even when one of the adults in the family have had COVID infection and the child hasn't had COVID infection, even then it will be good to test liver function among these children at least monthly for the first 3 months. And as soon as there is any elevation in liver tests or abnormality of liver tests or jaundice to see, that means yellowness in the eyes, etc., then a pediatrician or a liver specialist must be consulted. So that's how you get around this problem. We've seen some cases of tuberculosis drugs or medicines related hepatitis since a very long time. So that's called anti-tubercular therapy, ATT associated liver injury, or also called DILI, drug-induced liver injury. And in this case, the drug is anti-tubercular drugs. Now, that's been known to happen across the world forever, ever since the TB drugs have been used. But since the incidence of TB in India is high, these ATT medicines are used quite often. And typically, 2 to 4 months after they are being used, again, liver inflammation and liver injury can happen, which is called ATT-associated hepatitis. And in about 15 to 20% of the cases, this can be severe and result in liver failure. In fact, amongst the 3,700 odd liver transplants that we have done at Medanta Hospital, about 20 of them have been in patients who've had ATT-associated severe hepatitis and liver failure. Anybody who's taking anti-tubercular drugs should have liver function tests done every week for the first month, and then every 15 days for the next 4 to 5 months. As long as those medicines which are supposed to cause liver failure are continuing. So you should do frequent liver tests, and if there's any abnormality, then the TB drug should be stopped, and the patient needs to see the physician immediately.